Okay, so I don't know if you guys have seen the anatomy PDF they sent you just saying how it's going to run the semester, but you have 4 topics. So you have upper limb, lower limb, back, and thorax. And so upper limb's 4 weeks, lower limb's 4 weeks, back is 1 week, and thorax is 2 weeks. Then you have 1 week revision. So for for upper limb, lower limb, and back, you're going to need to know the bones, muscles, joints, neurovasculature, so nerves, arteries, veins, and some anatomical areas and clinical pathologies. But for thorax, that's your like most important system to take into second year. And so that one's a bit different because you have your heart, so that's a lot more focused on physiology rather than muscles and bones. So that's a bit different, but you'll see that when you get there. So yeah. So in terms of learning anatomy, you'll figure out your own method as semester goes on, but we have made the anatomy videos on our YouTube channel, and we're going to be releasing a starter pack either tonight or tomorrow, which you can find. And we're going to have slides up on our Google Drive and a link to our Notion page coming soon.
Yeah, that's like a new thing that we're starting this semester, given that first year seem to be using Notion quite often. So we thought it'd be useful to make one too.
So a bit of basic anatomy for you guys. So the main thing to start with is anatomical position. So literally how the picture shows it. So you have your palms facing up, and when you're describing the location of anything in the body, you describe it based on this position. So if you go to the next slide, it's got some of the main terms we use. So if you look at the picture on the left, the midline, if something's closer to the midline than something else, you say it's medial. If it's further away, it's lateral. And in terms of the limbs, you use proximal and distal. So your shoulder is more proximal than your elbow, and your wrist is more distal. And then also superior and inferior. So that's pretty straightforward, up and down. We also have 3 planes that we use. So we have the coronal plane, which is basically if you cut straight down through the middle of you. It's kind of a way that you could kind of remember it is, I guess, you can imagine like coronal, it kind of sounds like crown. So like if you put a crown on your head and it just cuts down straight through the middle, I don't know if that will help. And then you also have the sagittal plane. So that's vertical, but in the opposite direction to coronal. And then the transverse plane, which is just through the middle. And there's some other terms you use that are specific to certain parts. So like for your hand, you have the palmar surface, and then the back of your hand is the dorsal surface. And so same thing on your foot. The top of your foot is the dorsal surface, and the bottom is the plantar surface. And everything else there is pretty much the same as the first picture.
All right, so I'll be running through some of the movements. So you'll need to know these for both like anatomy and clin skills. And so I spent a while animating these, just so you can kind of really see like what movement is like what name. I'm not gonna bore you with going through each of these, but if you look at it, you probably will just remember like what they are. So we've got them for the arms, for the lower limb as well, if you scroll through. Yeah, so a lot of these you'll need to know like the angles. We haven't put them in here, but I think it's mostly just to establish like what is extension of the wrist, like what is abduction of the fingers. And yeah, that's pretty much it. You'll pick these up along the way. Like it's so confusing at the start, but as you like see them again and again, it sort of just like sinks in. Yep, with the lower limb ones as well. If we're missing any, do like chuck us a message. If you're like, oh, I have no idea what like, extension of something means, feel free to just send us a message anytime and we can explain it. And the next one is feet. Okay, so the one thing I think that a lot of us struggled with was remembering inversion and eversion. Yeah, act it out. Stella just said in the chat, it's a really good plan. And inversion and eversion, literally the only thing that helped me remember this was like that meme with the meme that I put here. It's like you just twist your ankle and like you invert it. So that's like an inversion injury. So if you just think about twisting your ankle, it's like it's inversion. This probably doesn't mean too much to you right now, just because you haven't seen it very much yet. But as you like are exposed to these terms throughout the semester, like definitely feel free to come back to these slides and just to look through them, and they'll help you remember what movement each of the words mean. Okay, so this is more pertinent to like real dissection and specimens, but I have a feeling given how we were taught this at the start of just all of last semester, you might be getting photos of dissections that have been done in the past and of like specimens. So essentially, when you first see this, you're like, what the actual hell am I looking at? Everything is like brown slash like yellowy. So you're like, bro, what shit? But to figure out like what structure. So nerves are like super stringy. They go to the muscles to innervate them, and that's what helps them move. You can kind of identify them because they're super stringy and they like join together, split off, and they're super variable in each specimen. So if you're like, bro, there's just like some like hairy things, it's probably a nerve. So vessels usually are a little bit thicker. They do have a lumen in the center that you can tell when you are doing dissections, but because they're likely just going to be showing you photos, it's going to be harder to identify. Arteries like hold their shape a lot better. They have a thicker wall, whereas veins are a little bit flatter and thinner because that wall is quite a bit thinner. And then you've got muscles, which literally look like, sounds bad, but like pulled pork, if you've seen what that looks like. And they've got like tendons at the end, which attach to the bones, which allow them to perform the function that they're supposed to. A pro tip for like when you're in the labs, which 2020 kind of be like that, but pro tip is to pull on the muscle to see what it does. So if you pull, let's say you're like looking at the upper limb, if you pull on a muscle and you see like the thumb moving, you can kind of conclude that that muscle goes on to move the thumb. Yeah, so if you guys do have like in-person lab stuff, definitely come back to these slides and know that you're not alone in being like, bro, what the fuck am I looking at? Because that's definitely how we all felt this as well. Okay, cool.
Okay, so just a bit about joints. Don't worry about memorizing this all that much now. It's more just, these are generic about joints for now. And later on, once you see the terms and you have no clue what they mean, or you want a more general understanding, you can come back to these slides. So we have three kinds of joints. So we have fibrous joints, cartilaginous joints, and synovial joints. And synovial is the most common type of joint. So that's the one you'll see most often. And those joints are freely movable and they contain a fluid-filled joint cavity within a fibrous capsule. The second type contains fibrocartilage or hyaline cartilage, and they generally don't move much. And the first type contains tough fibrous tissue, and it's generally joints that require strength. So synovial is the most common type, and there are a few types of synovial joints depending on, so they're named these ways depending on what they look like and how they move. So you have your hinge joint over on the side, and then, yep, and that one's usually a movement in one plane, so usually flexion and extension. And then you have your saddle joint, so it has like a convex and a concave surface that fit into each other. And then you have a plane joint, which is generally relatively flat surfaces. A pivot joint, which is top left, and that one's only rotation. And then you have a condyloid or ellipsoidal joint, and that one has a convex surface with a concave elliptical cavity, which is where the name comes from. And then you have a ball and socket joint, which is numerous axes, so like your hip joint. And so inside your synovial joint, you have the articular capsule. So it has a fibrous outer layer and a synovial inner layer. And you also have articular cartilage and synovial fluid inside for the purpose, mainly lubrication, also nutrient distribution and shock absorption. And then the supporting structures are ligaments and bursa. So ligaments, they're dense, regular connective tissue, and they resist any extreme movements that could damage the joint. And bursa are basically small sacs that are lined by synovial membrane, and they're filled with synovial fluid. So they're located at key points to stop friction. So they allow you to move without, so they allow the joint to move without causing any degeneration due to friction. So don't worry too much about understanding or learning any of this now, but you'll hear lots of these terms like synovial and bursa and ligaments and synovial fluid throughout the coming semester. So when you hear those, you can come back here to look at these slides to see what they mean.
Oh yeah, by the way, I might quickly add in just a kind of a note, because I didn't know about this until a bit later on, but ligaments basically join two bones, and this is contrasted with tendons, which joins one of your bones with your muscles. Just a bit of a side.
Yeah, which one's which? I remember that the Achilles tendon is muscle to bone. So just remember that as tendon and the other's ligament.
Awesome. So we'll basically take you through a couple of imaging things. So main three that you'll get is X-ray, CTs, and MRI. So what exactly is an X-ray? So majority of you guys probably have seen an X-ray at some point in your life, but pretty much it's a small box that emits a bunch of photons. And we have a person standing here, and this is the detector. And what your X-ray, so the film that comes out, it's basically due to the photons from the X-ray going through the person and hitting the detector. So if there's a lot of photons or radiation hitting the detector, your thing's going to come out black. And if it's being blocked by something, that's going to cause it to become white. So we'll talk about this in the next slide in a bit, but basically you'll get three different X-ray views. So you've got your AP, which just stands for anterior to posterior. So like the first one, PA, which is posterior to anterior, and then lateral, which is from one side to the other. You guys will get a bit more information on this for cardiac, but essentially your AP versus PA view, it can sometimes distort the size of certain things. So for example, if you take an AP view of a patient, that could enlarge the heart and make the heart look bigger than it actually is, which isn't ideal. But if you've got a patient who can't stand up for whatever reason and they're lying on the hospital bed, then that's usually why they would be taking an AP X-ray. So talking a bit about the different, I guess, radio densities that are present here. So you've got 5 main ones. We've got, first of all, metal. And because the photons can't really pass through metal that clearly, that's why it's popping up white. Then you've got your bone, which is relatively dense, which is also appearing kind of whitish. Then next we've got the fluid, and then the fat, and air, as you can see, is relatively black. So if you are getting confused as to like, oh yeah, this is black, what is it? Think, okay, we've got lots of radiation passing through it. That's why it's coming out as black. CTs is a little bit more different. So it's basically taken with a patient lying flat, and we've got a detector ring, and they basically take 360-degree scans. Once again, you've also got 3 different kinds of views. You've got your axial plane, which all of this will be on the next slide, so we'll go over that in a bit more detail. So axial plane, sagittal plane, and coronal. Basically, axial plane is the one that you'll probably get most commonly. So definitely make sure that you know what it is. If we have a look here, axial plane, it's essentially, imagine yourself standing at the patient's feet and you're looking up towards their head. So if we're looking at this particular image, this side is going to be corresponding to the patient's right-hand side versus this side is going to be corresponding to the patient's left. For this particular image, as you can see, this is going to be the spine of the particular patient, and this is probably the liver, which would be on the right-hand side. So that's just something that you can kind of think about when you're orientating yourself around this. Yeah, even though faculty, they don't tend to teach it that much in detail, they do expect you to know how to read a CT. So there's a couple of good resources that you can check out, such as I think radiography or something. It's written in the care package list, but you guys can have a look at that in your own time. Sagittal is like the sagittal plane from the side. So we're looking at the patient's like left hand side and you're moving gradually towards the patient's right. Coronal, once again, like coronal plane, you're looking at the patient from the front on.
All right, back to me. Okay, so MRIs is like the last type of imaging that you should probably kind of learn about. I don't think they come up as often as X-rays and all that, but you should sort of know like the gist of it. So the way that I like to think about it is like, it basically just detects where the hydrogen atoms are, and you find these in fat and water. And you've got 2 types of MRIs. So you've got type 1, which is like you see fat, and then type 2, which is fat and water. I think the thing that we were taught last year was like T2 equals H2O. So yeah, you can use that to remember. Next slide. Oh, also you don't actually need to know how it works. Like that's just how it helps me to remember like which one shows up. So we found some examples. So we've got T1 where you see like the fat here is bright. So you've got the subcutaneous fat on the posterior end of the body. That's bright, and you've got some bone marrow in your bones. And then with T2, you see that the cerebral spinal fluid, you'll learn about that later, but that's essentially fluid, H2O, and that's showing up bright as well. So that's T2. Don't really know if there's much else you need to know about these, but yeah, knowing the 2 types is probably helpful.
Yeah, that's pretty much all we have. That's like a very basic overview as to what anatomy is going to be about. We'll go into more detail in our actual PSP, PSP Zooms, but this pretty much gives you a good overview. Anything else that anyone else wants to add?